Canadians expect public funding to go towards public goods and services that help us all. For example, when Canadians invest in public infrastructure, we get better roads and bridges. But when Canada invests in pharmaceutical research and development, we don't actually get more affordable or accessible medicines in return. That's because the way we fund research for medicines is broken. Pharmaceutical companies are driven by profits. Their primary goals are not to address the most urgent public health needs. This leaves some of the world's deadliest diseases with no effective treatments. These diseases may only affect small groups of people, or may only be found in low-income countries. Because these are not likely to generate big profits, pharmaceutical companies have no incentive to invest in them. So this leaves many people, from Canadians affected by neglected diseases to people in countries with underfunded health systems, without the medicines they need. That's why public funding is so necessary. The Canadian government invests millions into medical research every year, often into medical needs that would otherwise be left unaddressed. But right now, this public funding comes with no strings attached. So despite investing millions of taxpayer dollars in medical research and development each year, Canada places virtually no conditions on those investments. Pharmaceutical companies can simply turn around and sell these medicines back to you and to the rest of the world at unaffordable prices. In a nutshell, we spend billions of dollars a year to research and develop new life-saving medicines and vaccines. But because we don't make that funding conditional, pharmaceutical companies can still charge us almost whatever price they want. This leaves Canadians paying twice, once for the original research, and again for the final product they need. This also leaves people and countries unable to pay these unaffordable prices without access to medicines they need. This is a broken system that can easily be fixed, and things don't have to stay this way. That's why Doctors Without Borders is calling on the Canadian government to ensure that public funding places lives over profits. We are asking the Canadian government to simply attach conditions to the millions of dollars it provides in funding each year to these pharmaceutical companies. Let's put lives ahead of profits in the way we research and develop new medicines. These simple conditions will make Canada-funded health innovations accessible, affordable, and available to those who need it most, both here in Canada and around the world.